Hello, good day. How are you today? You're good, right? Okay, are you ready for today's lesson? You are? That is good. Today in basic technology, we are going to be looking at first aid. Okay? Our topic for today in basic technology is on first aid. Are you ready for the lesson? You are, right? Good. So first, we are going to be looking at the meaning of first aid. Okay? First aid is the immediate assistance or treatment given to someone who has been injured or suddenly taken ill. Okay? First aid is the immediate and initial care provided to a person who has been injured or suddenly fallen sick. Okay? So we're going to be looking at the objectives of first aid. The objectives of first aid include preserve life, provide immediate care to sustain life until professional help arrives. Okay? Preserve life. You provide immediate care to sustain life until professional medical help arrives. Okay? Prevent further harm. Take actions to prevent the condition from worsening. You take actions to minimize the risk of additional injury. Promote recovery. Provide initial treatment to improve the chances of full recovery. You administer basic medical assistance to improve the chances of full recovery for the injured person or ill person. So these are the objectives of first aid: to preserve life, prevent further harm, and promote recovery. Okay? Do we understand? These objectives guide the fundamental principles of first aid in addressing emergencies and ensuring the well-being of individuals in need. Okay? So we're going to be looking at the qualities of a good first aider. What are the qualities of a good first aider? Knowledgeable. Possesses a solid understanding of basic first aid principles and techniques. A good first aider should be knowledgeable, should understand basic first aid principles and techniques. Okay? Calm and composed. Maintains composure in emergency situations to provide effective assistance. A good first aider should be calm and composed, maintains composure in emergency situations, be calm and composed. Another quality of a good first aider, empathetic, shows compassion and understanding towards the injured or ill person. A good first aider should be empathetic, should show compassion and understanding towards the injured or ill person. Quick decision maker, can assess situations rapidly and make effective decisions under pressure. So a good first aider should have the quality of being a quick decision maker, can make decision quickly. Okay? Even if the person is under pressure, you make decision quickly, rapidly. Good communicator clearly conveys information to emergency services and others involved. You communicate well with others. So a good first aider should have all these qualities, okay? Being knowledgeable, calm and composed, empathetic, quick decision maker, and good communicator. So these qualities are essential for a first aider to respond effectively and provide necessary aid in various situations. Do we understand? Good. So we're going to be looking at first aid materials. Okay? First aid materials. 1. Bandages for wound dressing and support. Bandages are for covering and supporting wound. Okay? Antiseptic wipes to clean wounds and prevent infection. Antiseptic wipes are used to clean wounds. Adhesive tape used to secure bandages and dressings. So the adhesive tape is used for securing bandages. Okay? Scissors for cutting tapes, bandages, and clothing if necessary. The scissors is used for cutting tapes, bandages. Okay? Gloves to protect both the first aider and the injured person from infection. So gloves are worn to protect against infection. Sterile gauze pads for covering wounds and absorbing blood. They are used for covering wounds and absorbing blood. CPR marks for performing CPR safely. Okay? So these are the materials for first aid: bandages, antiseptic wipes, adhesive tape, scissors, gloves, sterile gauze pads, CPR marks. Okay? These first aid materials are items and supplies essential for providing immediate care and assistance in emergencies. Do we understand? These materials we mentioned are used to address injuries or sudden illnesses, to prevent infections and stabilize the condition of the injured or ill person until a professional medical help is available. Okay? Good. Basic first aid for common injuries. We are going to be looking at some common injuries and immediate care for them, okay? Cuts and scrapes. Clean the wound, apply an antiseptic, and cover with a sterile bandage. So for cuts and scrapes, you clean the wound with mild soap and water, apply an antiseptic ointment, okay? Then you cover with a sterile bandage. Burns. Cool the burn with running water, cover with a clean cloth, and seek medical help if severe. Okay, how do you care for burns? First, cool the burn with running water for maybe at least 10 minutes. Then you cover with a clean, non-stick cloth, okay? Then if it is serious, you seek for medical help. Sprains and strains. Rest the affected area, apply ice, compress with a bandage, and elevate. Okay? When taking care of sprains and strains, rest the injured area, apply ice to reduce swelling, okay? Then you compress with a bandage. After that, you elevate the injured limb if possible. Good. Then fractures. Immobilize the injured area, support it with a splint, and seek professional medical help. When taking care of fractures, you immobilize the injured area, support with a splint, and then seek professional medical help. Okay? Do we understand? The goal of a first aid is to stabilize the condition, prevent further harm, and promote recovery until professional medical care is present. Okay? Do you understand? All these are common injuries and how to take care of them. If anybody around you has these common injuries, you apply first aid. Or if it's you, you apply first aid first if there's nobody around to apply it for you. Okay? Do we understand? Good. So today's lesson on first aid, we understood everything, right? We talked about the meaning of first aid, objectives of first aid, qualities of a good first aider, first aid materials, and the basic first aid for common injuries, right? So we understood everything on today's lesson. Okay, good. So next we're going to be looking at our assignment. I'm sure we are going to be able to do our assignment, right? Okay, that is good.